there. And so looking at that, here's the example here that I show you with blood instead of cars, is, you can imagine if all three of these blood vessels move at the same time, I mean, not blood vessels, sorry, drops of blood move at the same time, exactly the same time, then I have three of them crossing that area, cross-sectional area, per whatever my unit is. So if my unit is minutes, I have 3 per minute, 3 drops of blood. And if we say each drop of blood, so 3 of these per minute. Now, a drop of blood, of course, is very small, but now if we go ahead and say 3 of those are symbolic representations of 1 milliliter, well, then I'm moving 3 milliliters per minute. Compared to the smaller tube, I don't have room for 3. So even if I move at the exact same velocity, okay, then now I'm only moving 1 drop of blood per minute, or 1 milliliter. Whoops, that's supposed to be a drop, not a 10. So that's a drop. Or so 1 milliliter blood per minute. On the other hand, let's change this story. If my goal, so if I don't change pressure, if pressure remains the same, and instead what I'm looking at, or let me correct myself. So if pressure remains the same, nothing else changes except for the diameter of the blood vessel, then essentially my flow rate is going to change. My velocity can stay constant, but my flow rate will change. So if I keep the same velocity, then I'm going to have a decrease in flow rate when my area changes or decreases. On the other hand, if the goal is to make Q constant, so if Q is constant, now I'm going to have to change my velocity. So let me explain that. Let's say these are the same exact blood vessels. So this is my dilated blood vessel, and this is my constricted. So dilated blood vessel, if I want to move all 3, relatively easy. So if my goal is to move 3 of my drops of blood per minute in my dilated blood vessel, I can do that. Now if I want to move exactly the same in the smaller tube, now instead of moving 3 at a time, I can only move 1 at a time. But if my goal must be keep constant Q, then I must have 3 drops of blood moving per minute. The only way I can make sure these stay the same when I have a narrow or a smaller diameter is by increasing the rate of flow. And that is one method that we use to maintain blood flow. And it does have some important comprehension. I'm looking at the next word, sorry. My bad. It has some important consequences, and that brings us here to this comprehension question. So what I'm asking in this question here is for you to do a little bit of thinking. And what I want you to think about is if we assume here's my normal healthy artery, and my goal is to move, my cardiac output is 5 liters per blood per minute. Let's imagine this is in a major artery, so maybe it's even the aorta. Just to make this thought exercise simple, let's say if I'm moving 5 liters of blood per minute out of my heart into my aorta in a normal healthy individual, but now that individual has this buildup of plaque. Here's my plaque. Now what is plaque? It's cholesterol starts accumulating on the surface of the blood vessel, and then macrophages come in to try to remove that cholesterol, but as they try to gobble up the cholesterol, they actually turn into something called foam cells. And anyway, we ended up with damage to the blood vessel and a buildup of this plaque that forms. Well, now look at the radius right here. We've just majorly changed my R. And as a consequence, what's that going to do to the flow of blood? Well, it's going to create a tremendously large amount of resistance. So if I need to make sure that even despite the narrow artery, I'm still moving 5 liters per minute, because that's how much my body needs, my muscles need that much blood, my organs need that much blood, then how do I accomplish that? So that's essentially what the question is asking. Arteriosclerosis occurs when plaques of fatty materials are deposited on the inner arterial wall, narrowing the arteries. How does the body attempt to compensate for arteriosclerosis in order to maintain cardiac output? And I'm sorry, that's arteriosclerosis. Arteriosclerosis and arteriosclerosis, just one letter difference. Different properties. Arterial with a TH, A-R-T-H, is with the plaque builds up in the walls. Arterio is when the arteries lose their elastic fibers. But anyway, we're looking at arteriosclerosis with a TH. So how does it affect, how does the body compensate? And your choices are A, the velocity of blood flowing through the clogged arteries must increase. B, the force or pressure of the blood in the clogged arteries must decrease. And C, the heart must contract faster or harder to drive blood through the clogged arteries. In order to move that blood, both velocity must increase, right? We're going to have to drive it faster, push harder. Heart's going to have to contract faster and harder to give the pressure necessary to drive that through the blood. For B, that one's actually false. We actually have to increase pressure. So if this were to say increase, then B would be correct.
You see me?